Hi, I'm Walt Mabe. I'd like to take this opportunity to say thank you for coming and visiting with us on video. And we're going to take a few minutes and talk about the virus that's affecting our neighborhoods. And first thing we want to do is introduce the people that are going to be on our boards. And right now, to my left is the mayor of the town of Front Royal. And after the mayor, we're going to speak with DeAnna Cheatham. She is director of the DSS here in town, and she's going to give us a heads up on everything that's going on over there. And first thing I'm going to do is turn it over to the mayor for a few minutes.
Thanks, Mr. Mabe. It's good to be here this afternoon. I just want to make a few statements, ensure the citizens that we're doing everything we can to bring this pandemic to a head. Hopefully it'll be done in the next 30, 60 days. We just don't have any idea, but I want to make sure that everybody's aware that the town is operating under the same pretense we had before. We have all of our staff either working in the offices or at home, and we have all the duties that they've done before are still being done. So if there's anything that anyone needs that they have to get in touch with the town, just call the town and they'll give you the person that they need to cover the things that you are looking for, the things you need. We are, this evening at 7 o'clock, we are doing a meeting to go over our budget. We want to let everybody know that right now we're looking at a $2 million shortfall in the next 3 months for the town. Tonight we're going to look at those figures, and hopefully Monday night we'll make a change in our budget to include those in our budget through a transfer. So I want to let everybody know again that we're working towards the best interests of the community in the town of Front Royal. And if you have anything you'd like to talk to me about personally, my phone number's in the phone book, and I'd be more than glad to entertain you at any time. So with that, we'll turn that over back to Chairman of the Board of Supervisors, Walt Mabe.
Thank you, Mayor. Now's the time for us to be the most careful. The peak of this virus in Virginia is supposed to happen over the next few weeks. And if it does, that'll be great. But if it doesn't, we need to continue to be vigilant to do the things that we know what to do to deter the virus. Wash our hands, keep our distance. You know the drill. I can go over and over and over it, but I don't want to do that. But I want you to please be vigilant in taking care of your neighbors, your friends, your veterans, your older folks, your church members, anybody that you associate yourself with. Please contact them to make sure that they're okay. Do they need anything? I know that there are people that will always need something. And if you don't ask, they may not tell you, or they may not call you. But a big portion of our resources are coming from the Department of Social Services. We've got DeAnna Cheatham here, and she's going to talk with us for a few minutes about what they're doing and all of the things that are being very positive. And I believe that she's got with her Michelle Smeltzer to talk in case it's needed. But right now, I'm going to turn it over to you.
Absolutely. Well, thank you so much for having us here today. And to my right, I do have Michelle Smeltzer, who is the community liaison. I have just some information. I want to make sure that the community understands and knows that during these very troubling times that the Department of Social Services, even though our doors are closed to the public, that we are very much still not only able to assist you from a distance, but that I also still have staff that are completing child protective services and adult protective services complaints and investigations. And so they're still out in the community. They're still knocking on the doors. My benefit staff right now are being inundated with processing cases. We understand that there's a need in the community. People have been laid off from jobs, hours have been cut, and that there's some uncertainty in regards to how are you going to get your basic needs met, how are you going to get those food securities met, and even in regards to rent and utilities. These are very real concerns that are facing our community, and DSS is here to be able to assist in any way that we can. So for people that may not be aware of all the services that social services does provide, you may be aware of either one side of the house or the other side of the house and not quite realize how much of it is actually done all in one building. Should I continue? Okay. So first and foremost, as most people know and some people may not know, that DSS is responsible for providing SNAP benefits. And SNAP stands for Supplemental Nutrition Assistance Program. That program was formerly known as food stamps, if you're unaware of that. The benefit of having food stamps means that you know that your family is going to be able to get the food resources that they need without having to be worried about if you're going to have the money for that. Now, that is a benefit, and it's something that you have to apply for. Any of these services, whether it's SNAP, whether it's Medicaid, which are our insurance programs, whether it's TANF, which is our temporary assistance for needy families, which is that cash money that families are able to receive, you can apply for those benefits online through Common Help. That address is commonhelp.virginia.gov, and Virginia is all spelled out. That information on the Common Help page is an interactive application, and there's also an interactive screening form that's used so that if you're not sure if you'll be able to qualify or not, you can put in information. You don't have to have Social Security numbers and all of that just to use the screening form. You put in the information, and then you're able to see you may qualify for this benefit or you may qualify for that benefit without spending a ton of time applying online. But you can always complete those applications online. If for some reason you don't have access to the internet, we're more than happy to either take that application over the phone. The phone number to call to have that application completed over the phone is 855-635-4370. Again, that's 855-635-4370. That application can be completed over the phone, and if need be, we can even mail you out an application, and that application can be returned to our office. There's a drop box right outside in our parking lot where you're able to drop that information off. For households, if you're looking at processing times and thinking, how long is it going to take to have an application processed, for those households that have little to absolutely no income, we're able to process applications in 7 days or less. Those are our expedited applications, and that means that your application is processed. We're able to provide you with your EBT card, so that's the card that you'd use to be able to spend your allowance at the store. We're able to provide that within 7 days. If for some reason you need food prior to that 7 days and you're in dire straits, please do not hesitate to call my office. My number, of course, is 540-635-3430, and we'll be able to link you with some resources in the community that I'll discuss a little bit later on to be able to make sure that you've got some food for you and your family. In addition to our regular SNAP benefits, there was an emergency SNAP benefit that was issued on March 25th, and that will be issued again on April 16th of this month. That benefit, the emergency benefit amount, what that did was for families that were not receiving the maximum SNAP benefit allowance, it put them to the maximum amount for their household size. So we know that children are home from school, again, people that are typically at work and hours cut and whatnot, it allows those families to be able to receive the maximum SNAP benefit that's allowed under the SNAP program. And that varies depending on household. So again, that next emergency disbursement date is April 16th. There are a number of things that the state has also sent down in regards to policy to allow the departments across the state to be able to process more applications, not only just to process more applications, but to ensure that during this time that families and children are not going without having their assistance. So cases will not be closed. SNAP cases will not be closed at this point in time. Medicaid cases, which again is the insurance, those cases will only be closed under certain criteria. One of those if a person dies, another is if a person moves permanently out of the state, and the final one is if the person calls in and requests that it be closed. So Medicaid cases will not be closing, SNAP cases will not be closing. In addition, if anyone happened to have a SNAP renewal or a child care renewal that needed to be processed, those renewal times have been extended. So people that were coming up to be renewed between March and the end of May, that processing time has been extended now to where they'll actually have an additional 6 months before they'll have to recertify. And hopefully by that point in time, the coronavirus will have decided to dissipate, and we'll be able to get back to doing interviews and what have you. I also just want to provide a little bit more information in regards to the Medicaid It was mentioned earlier that Medicaid right now is not requiring any sort of copay. So for some of the services and for folks that are receiving Medicaid, they're required to pay a copay. During this COVID-19 crisis, there will be no Medicaid payment, no co-payment required. And that's certainly very much needed when you have families that are not able to work and are concerned about needing to go to the doctor but don't have the finances to be able to go to the doctor. So just want to make sure that everybody understands there is no Medicaid copay at this time either. Another thing that I just wanted to bring up is that I mentioned briefly about temporary assistance for needy families, or TANF. TANF is the cash money that families with little to no income are able to receive. One of the important things about TANF during this time for people that have been laid off, you may very well be concerned about how are you going to pay your rent, or how are you going to look at paying your utility bill. I understand that multiple utility companies are no longer, disconnecting, but at some point in time those bills are going to come due. Or, what are you going to do if you need to have your cell phone bill paid and that's the way you're getting access, for other jobs to contact you or what have you. There are a couple of different programs that fall under that TANF umbrella. One of those is diversionary assistance. Diversionary assistance is a little bit different from TANF, where TANF provides a month-to-month assistance. So month-to-month, you would get a certain amount of money, depending, of course, on your family size, that would be loaded to your bank card or to your debit card that's issued by the state. With the difference of diversionary assistance is that there's a one-time, one lump sum payment that's put on that card, or checks are mailed out to the people that need it. So that's the difference between TANF and diversionary. There's also a different subcategory of both of those that's called TANF emergency assistance. And that's available to people that have suffered a disaster, and the coronavirus has been declared a disaster. So that financial assistance is also available. So that can go to cover any sort of essential need as identified by the family. Again, that can be for rent, that can be for cell phone, that could be for any sort of additional need. If it's even for a vehicle payment, that TANF diversionary assistance or TANF emergency assistance can help with that. We also offer child care assistance, and lately we've seen a little bit of a decline in, of course, child care applications, which would be expected during this time when we see that people are being furloughed or are losing their jobs. Right now there is a waiting list for child care assistance in the county, but as we see more and more people losing their jobs, we might not continue to have that waiting list. Child care assistance, in essence, allows families to be able to take their children to child care centers, daycare centers in the area or outside of the area, truthfully, and to only either have to pay a small amount of a copay or no copay at all if you're receiving TANF. So it allows children to receive either education and or supervision while the parents are working. As you all are also aware, we have a homeless population here in Warren County. The department has instituted 2 days a week on Mondays and Wednesdays, where individuals that use the department's address to be able to receive correspondence in regards to their benefits, they'll be able to pick up their mail. Mail will be picked up on Monday and Wednesday between 2 and 4. Right now we're doing that with absolutely minimal contact in the foyer of our office, where there's basically it's encased in glass, so there's really not any contact between my staff. The remainder of the office does remain closed to the public. This week we had a couple of people that came by and picked up your mail, and if you're uncertain if you have mail there and don't want to take that trip out, and we absolutely don't want you to take that trip out if you don't have to, then you can certainly feel free to call ahead of time and ask whether or not we have any mail for you. In addition to all of the required benefits and things that social services already provides to the community, during this, as we've mentioned, unprecedented time of the coronavirus, we're all needing to come together to do as much as we can with what we have to make sure that the community has what they need. On last Wednesday, April 1st, the department started partnering with CCAP to be able to provide food services to people here in the community. We all know that CCAP closed its doors a little bit over, 2 weeks ago at this point in time, and we understood that there was a need for people to still be able to receive those food services. So the department partnered to do a drive-through, almost completely contactless distribution program. And so far, we are actually very happy to say that that program has been successful. So to date, we've had a total of 55 people that have been served with 165 bags of food, including 55 bags of personal hygiene items, which include toilet paper. And there's also been some dog and cat food that has also been provided. We were really happy to have Living Waters Church that joined us. The pastor of that church, his wife, and his grandchildren joined us on Wednesday, and they added an extra bonus. If you've been at home right now for going on a month or a little more than a month with kids, the weather's starting to break, kids are getting a little antsy, and you're trying to find something for them to do. So they came up with a really neat idea of finding donated games. So they brought out a bunch of donated games and books so that people could not only grab their food, grab their cat food, grab their toiletry items, but also be able to have some sort of entertainment while their kids were at home, to still be able to engage the family. We were also able to give out some bread that had been donated from one of the local bakers in town, and I apologize because I don't have that name, but we are most appreciative. We've also received donations from the community in regards to bags and some food donations while we've been out there. So we're much appreciative for the efforts of the community to still provide, even in these dire times and dire straits, to other people that are even more in need. I'll speak briefly in regards to the thermal shelter, and I'll allow Michelle Smeltzer to also speak in regards to the thermal shelter. The thermal shelter is actually relocated, and right now it's being housed at the 15th Street Gym. So it's on the gymnasium side of the Health and Human Services complex. Michelle has more information in regards, but it looks like we're serving about 17 people a night. And I've had a few questions, and I'd just like to address one of the questions in regards to why did the thermal shelter extend their services that typically would have ended a week or so ago. It's important for people to realize that during this time, we know that the parks are closed. We know that toileting facilities and restaurants and places that are public buildings even, that those places are now closed. And that does create a problem for people that do not have homes in which to be able to take care of those daily needs. So with the thermal shelter being open, it does allow people, and some of the people at the thermal shelter do work. So it does allow those people to be able to take care of their daily needs as well as to be able to those personal hygiene needs, and for us to not have an additional issue that we certainly don't want to have in the county. There's one additional piece of information before I turn it over to Michelle that I just want to make sure everyone is aware of. As we know that there are businesses and offices that have closed, and there's still a need for resources here in the community. And if you don't know, there'll also be a press release coming out about this, but there is an app for that, so to speak. Warren County, Virginia Resources is an app that's available on all iPhones and all Apple products. And that app has information in regards to the services in the community and truthfully outside of the community as well. That app has been updated. It has information in regards to COVID. It has information in regards to shelters, for food, for transportation, for crisis services, mental health services. There's lots of information on that app. So please feel free to download that information. And if there's anything that you can take from anything that I say today, one, by all means, stay home. Don't go out if you don't have to. But if there's a question that you have in regards to where are you going to get food from, what are you going to do about insurance, if you have a question or a concern, please feel free to call my office. We are still available. We are still there. Staff's in the office half of the time and out of the office half the time. And one population that I didn't speak of, you all may have seen, if you've had to go out, some pinwheels popping up around the community. April is Child Abuse Prevention Month, and during this time we typically hold our Child Abuse Prevention Jubilee. Unfortunately, because of COVID, that Jubilee has had to be canceled or postponed if we're able to put it on at a later date. But please make sure that we're also looking out for the children in the community that are typically seen a little bit more often, whether it's at school, through religious events, or even community parks and recreational activities. Please make sure that you're looking out for them as well. And if you see something, please by all means say something. Our office is available to be reached 24 hours a day, 7 days a week. You can call our office, my office, you can call the Sheriff's Department, Police Department, or the state hotline to report child abuse or neglect. Please know that my staff is diligently working to make sure that we're able to service the needs of everyone in the community. We're making sure that everybody has computer access to be able to access the secured systems, and we're making sure that people are able to to get everything that they need that we're able to offer. When you're thinking about first responders, you're thinking about essential personnel, please know that we are there with you. Our hearts and minds are there with you, and we hope that we'll all get through this together and we're better together. Michelle?
With the thermal shelter, we're very, very pleased that the county has been working with us and making us available to stay open for another, maybe as long as 10 weeks. And we were up to 19. One of our gentlemen was able to obtain employment on a farm and move out to the farm. So we lost one, but that's what we're there for. We're there to lift them up and hopefully make it so that they can move on. A lot of the questions I receive are the food that we have in the community that's available through the different resources such as churches. There's a program out there, it's called Reaching Out Now, that works in the schools. And because the schools are closed, they've kind of changed their focus. And starting April 1st, they have 5 families from each of the 9 schools in Warren County that are in the most need. They've been identified as the most needy in that school as far as food goes. And so they have partnered with some restaurants in town and a chef who is preparing close to 300 meals. This is a week. So they're delivered to 50 families in Warren County by volunteers, and this is a completely volunteer effort. They're planning on doing this through the whole COVID 10 weeks that we have. Hopefully, we won't have that much, but through the whole crisis that we're going through. Also, there's Dinner Together that's done at the First Baptist Church. It's Monday through Thursday and Saturdays between 5 and 6 p.m. You can go through and get a to-go dinner. That is available to anyone who comes. They have served up to 250 meals a week through that program. Reach is another program done through the First Front Royal Presbyterian Church, and they give shelf-stable food to needy families once a month. There's also a superhero program that's done through the Front Royal Presbyterian, and they provide food for children and their families every week. So, and all that does not include Meals on Wheels, and I know they're still operating in the community, and I don't have the information on them, but there's a lot of food resources out there for everybody.
Excellent. There is one more thing that I'd like to add. We can't do the work that we do without you all being able to provide information and sharing information with the department. And along those lines, I was contacted earlier this week from a lady from Newfound Families, and she was reaching out to local agencies because like I said, we're also still out in the homes and we're still knocking on doors and staff still need to be protected. And she'll be bringing out masks for my staff, cloth masks for my staff to be able to wear when they're in the office or if they're out and about and unable to maintain that 6 feet distance. She's also helping to provide some hand sanitizer as she can even come across it, and looking for other needs that the community may have. We know that the thermal shelter is in need of a temporal lobe thermometer, so she's also trying to assist with that. So just want to thank the community partners that have come together to make sure that the folks in the community, including my staff, including your neighbors and the children, have what they need to be successful and so that we can all get through this.
Thank you very much for very informative few minutes. You crammed a lot in there. That's great. As you can see, I think from the discussions here, Warren County, the town of Front Royal, all of the all the auxiliary offices, we're doing everything that we can to think about what we need for the county residences and the businesses. A few of the businesses are still up and running. They're doing carry-out dinners. If you need to get out and give some of them a call and just pick up your meal and pay them and go on back home, you're helping them. And also, just to let you know, the support for the area businesses, our EDA is providing assistances to local businesses to get them through the rough period. I advise any of the local businesses that are having potential problems or know that problems are coming into the future to call the EDA at 540-635-2182 with questions about federal and state funds that are opening up. There may be a way that they can help you. Just keep your doors open. We want you to be kind. We want you to help your neighbors. We want you to help other county residences, and we're hoping that you will help other county residents help each other. Sorry for the confusion there. Used lips today. But I can't stress enough how important it is for you to talk to your neighbors and to make sure that everybody is in good shape, and we're helping everybody that we can. There's a lot of opportunity out there for help. We need you to reach out and grab it. People want to help you find the needs that you have. With that, I think we can call it an afternoon. I want to thank the mayor for coming in. I want to thank DeAnna and Michelle. And if there's any questions, we're happy to take those. Any questions from the press?
If I may, Rural Examiner, Ms. Cheatham, have you seen a significant jump in numbers of applications for different programs since this emergency's been declared and the consequences you've talked about?
Absolutely. We actually have. I mentioned it the other day at the Board of Supervisors meeting where we've seen a significant increase in applications. For example, we've seen where SNAP applications have increased to almost tripled the number that we'd had the same time last month, same week and time last month. And then we're also seeing where people that have been screened for expedited applications, where they've increased almost tenfold. Now, by saying that, that doesn't mean that everybody that's screened and comes up as being as expedited, that they end up being expedited when it comes to processing. But that's a significant increase in comparison to, at one point in time, we only got 26 applications this same time last month, as opposed to 73 applications. So that's a significant increase in what we're seeing.
One other thing related to that, nationally you hear statistics with everybody being forced home and unemployment that there's been a rise nationally in domestic abuse reports. Have you seen anything like that here?
We are seeing where there is a rise in various complaints. So, the domestic violence complaints, depending on whether there's a child involved in those or not involved in those, may or may not come to Child Protective Services and to the knowledge of social services, but they may be coming to the knowledge of the police department or the sheriff's department. And I also am understanding that there's likely to be a rise in all those situations. We have to understand that anytime people are already struggling with mental health issues or substance abuse issues, that any sort of additional stressor is only going to exacerbate those issues further. So we're likely, the longer this plays out, the more we're likely to see that.
Anything else?
This may be more a question for tonight, Gene, but the mayor earlier said that the town is looking at a $2 million shortfall in its upcoming budget. Are those anticipated shortfalls, or is this all related to the COVID emergency and loss of revenue from retail taxes, whatever kind of taxes are impacted through this?
Really, at this point right now, we have three versions that our town manager and our finance director put together. It appears that it's roughly $2 million that we're going to try to balance the budget through projects and through things that we really are able to cut out of the budget that we feel that they're not of a necessity at this time. So we're hoping that we can carry on with that, and hopefully that we can see a change in the future, that these tax things, and such as meals tax and the lodging tax, will come forward more fluently than we're thinking at this point. So yes, for tonight we'll be talking about that, and our town manager will be giving us a major report on these issues, and hopefully that we'll be able to sustain the budget for this year. That does include next year. This is just for the 3 months left for this year.
That being said, thank you very much. We appreciate you visiting with us, and we'll look forward to talking with you next week. Thank you.